Generally speaking, how many people have controlled seizures on a single pill versus requiring two pills or three pills? And how long does it take for you to get the seizures under control? The reason I ask this is especially in our family back home in Pakistan, they would see one doctor and start one treatment. And if they don't get better within a week, they would go to a different doctor, maybe a third doctor, maybe a quack, maybe a homeopath, maybe a Rohani alim like Baba who will give them a wazifa, which is perfectly fine. But just the importance of sticking to your physicians and following up a plan. If one thing is not working, you switch to the other. In your experience, how does the treatment, stepwise approach to the treatment look like when you are dealing with kids with epilepsy?
In general, like when you give first medication, there is a 46% or 50% chance that this medicine will work.
I see.
So then you need to have another medication. So when there is a need for second medication, and we call the failure of the first medication after you have reached through the like the full recommended dose. It's not
Yeah.
like you gave the lowest quantity of medication and then it didn't work and you saw it's failure. That's not the failure. It's
Hmm.
like you have to fine tune the dose. So
I see.
if that has failed, then you add the second anti-seizure medication. The second anti-seizure medicine will take a control of 34% more people.
I see.
Okay. So then there is a role of third anti-seizure medicine. The third anti-seizure medicine usually just adds 4%
Hmm.
value, which means that this is the time your child has a drug resistant epilepsy. And
Hmm.
maybe this is the time that we have to think something more than medication.
I see.
Something more than medication could be diet. We call it ketogenic diet. It could be like some kind of device which we can put in your body or which can control seizures. Or it could be something more. It could be like one of the surgical options.